Thanks, Paddy. Thanks for that introduction, and thanks for giving me my first job in the drugs field. It's an absolute honour to give this lecture in memory of Alison Chesney and Eddie Killoran. As Paddy says, my first job in the drug field was working with Paddy for Alison Chesney when she was the head of Cranstoun Drug Projects at that time. Working with Paddy, Mike Trace, Paolo Pertica in the then Prisoners Resource Service was a huge privilege. I learned so much from them. And it started me thinking about many of the themes that have informed my career and informed this lecture today. One of the stories that is told about Eddie Killoran in his obituary by John Podmore is about him breaking into his headmaster's office at school and breaking the canes that were used to beat boys and to punish them. And what I'd like to do today is ask a question inspired by Eddie and Alison's work, which is, what happens when we break the cane of criminalisation? The dominant mode of drug policy across the United Nations is, and it's single convention narcotic drugs, which requires that countries have in place systems to punish people for making various uses of substances. And we're seeing movements away from that in terms of various alternatives to criminalisation. And we hope that we can break this cane of punishment and have these alternatives in order to reduce the pains of punishment and increase the support we can provide to people who have problems with their drug use. And three ways we might do that include depenalising drug possession, diverting drug offenders from the criminal justice system, or even decriminalising the possession and use of drugs. A fourth way is legalization, which I won't spend much time on today, but I'll focus on these alternatives to criminalisation of possession and use rather than models for supply. Now, these offer great opportunities, as I'll discuss, but there are also dangers here, as I have seen repeatedly in my career over the last 25 years, of merging treatment and criminal justice systems so that we might indeed end up providing more punishment to people who use drugs via what another intellectual mentor of mine, Stan Cohen, has called these three mechanisms: net widening, or increasing the size of the net, increasing the number of people who are drawn into some sort of penal control, or mesh thinning, the process Cohen describes where it becomes harder and heavier to be in the net of control and harder to get out of it because the gaps in it become smaller and smaller and the mechanisms of control become tighter and tighter. And there's this third danger that Stan Cohen talked about in his book, Visions of Social Control, where he talks about social control entrepreneurship and the temptation of people who, perhaps with great intentions, set out to work with the state to reduce the use of punishment, but end up, through their willingness to capture larger shares of the market of welfare and control, being entrepreneurs in the process of social control. So my lecture today will be looking at these forms of alternative to criminalisation and whether we're achieving the aim of supporting and not punishing, or whether we're increasing the levels of social control we're applying to these people who are being caught up in our nets. Let me find where I can move this on. I hope I can move it on there. Yes. So before I'm going on to describe these examples of ways of alternatives to criminalisation for people who use drugs, I'd like you to consider these questions that Stan Cohen poses to us. And as we're going through this list of examples I'm going to display to you, I'd like you to be asking yourself these questions. With these alternatives to criminalisation, what is the size and density of the net? How wide and strong is the net we're throwing over people who use drugs? The second question about identity and visibility. Can we see the net? Are we recognising the elements of social control that we retain in these alternatives to criminalisation for who use drugs? Can we recognize it for what it is, or are we fooling ourselves that paternalistically we're not replacing one form of control for another? And the third question, penetration, he describes it as, how does the net affect the people and processes around it? Do the ways that we're providing alternatives to decriminalisation do something to the system that means that it is reducing the amount of punishment, or maybe it's increasing the control we're placing on people's lives for whose activities we may not agree with? So I'm hoping you'll ask yourselves these questions as we look at these alternatives, which I've categorized in this way. This is based on some work I did with Caitlin Hughes and colleagues for the Irish government, where we classified the alternatives that were being used in different countries for dealing with people for simple drug possession. So that's drug possession without intent to supply or evidence of production or distribution of those substances. And we classified these alternatives in three broad categories: depenalization, or the decision not to apply the laws that are in place around possession and use of these substances; diversion, or the various mechanisms that might be used to divert people away from punishment and towards treatment or welfare services; and decriminalization, which is the removal in law of penalties of the criminal offence of drug possession or use. Now, that's the top level of this taxonomy, these three different categories. But within the two of those categories, we find subtypes. So, for example, within the category of diversion, this can be done either in a de facto manner by changing the practice of police or prosecutors without changing the law, or it can be done in a de jure way by actually changing the law to allow or mandate the police to divert people away from punishment. And within decriminalisation, we found three different categories. So on the right-hand side of this diagram, you'll see the fullest form of decriminalisation, which is decriminalisation with no sanctions. This means we remove the offence of drug possession or use from the criminal law and don't replace it with civil penalties. But there is a category, decriminalisation with civil sanctions, where that criminal offence is replaced with a civil or administrative offence, and the criminal penalties are replaced with civil or administrative sanctions. There's also a hybrid form that you see in the middle of this bottom row, where decriminalisation, so the removal of the criminal offence from the criminal law, is accompanied with diversion. And so that's the example most famously exemplified by Portugal. And I'll get to that in this list that I'm just about to show you of the different countries and places that have implemented these different types. So starting with depenalisation, as I said, this is the use of discretion of the police or prosecutors without changing the law to avoid inflicting the pains or punishments or criminal records of this criminalisation process that we're trying to avoid. This was done in Denmark between 1969 and 2004, where the arrest and prosecution of people who are found in possession of small quantities of controlled substances was replaced with police issuing warnings instead. This has also been done in my own country, in England and Wales, since 2004. In 2004, the police service introduced what were known as the cannabis warnings. This gave the police the opportunity to, instead of arresting, cautioning, convicting people for the possession of small amounts of cannabis, people could be given a warning right there and then on the street, which was just a written ticket that said you have been warned for your possession of small amounts of cannabis. This was in place for several years, but has more recently fallen into disuse as the police in England have been making more use of what's known as community resolutions, a broader mechanism for just dealing with an offence on the street without having to arrest or take someone to the police station or give them a criminal record in the form of caution or a further charge. Now, these are, would seem to be, and indeed are, useful mechanisms to avoid the harms and costs of arrest. But we also did see some evidence in England of this net widening effect. So this is a graph taken from some work carried out by Mike Shiner of the London School of Economics back in 2015. And he looked at the official data on the use of these warnings compared to the cautions that were the alternative sanction for these low-level cannabis offences. And the middle grey line, which is the number of criminal cautions that were given for cannabis offences, indeed did fall in 2004. So fewer people getting a criminal record for cannabis possession. But what you see in the big black line that increases so much is that because this was a much easier way for the police to deal with a cannabis possession offence, and because the police were at that time given targets for the number of offences they should bring to justice, so how many offences they were basically detecting, this actually led to an increase in the numbers of people who were given some sort of formal interaction with the police. We have research, for example, from Hamish Warburton and colleagues that showed that prior to this, it was quite common for police simply to dispose of cannabis that they found on people without going through any sort of process whatsoever, in order to avoid spending about 10 hours or so processing people, taking them to a police station and taking them through the criminal justice system. What the cannabis warning and subsequently the community resolution allowed the police to do was to increase this net of control by getting people into their databases for the use of cannabis, even though people were not getting such a punishment in the form of a criminal record with the caution. Our first example here of net widening. The second type in this taxonomy that I showed you is de jure police diversion. So again, de facto police diversion. Again, no change in the law, but changes in the practice of police and prosecutors in order to divert people who are found in possession of small quantities of drugs away from charge and prosecution and towards some form of therapeutic or educative intervention. And there are several examples of this around the world, including in Australian states. In England, it's currently available in at least 4 policing areas in Durham, West Midlands, Thames Valley, and Bristol. And under these schemes, we have seen consistently in the countries and places where it's been done, reductions in arrests and reductions in the costs of these criminal justice processes, along with less damage to job prospects and relationships. We know, for example, that criminalising people damages their job prospects. Criminalising people damages the relationship they have with their families. And when we can avoid doing that by not giving them these criminal records, and perhaps by diverting them to more therapeutic or educative forms of intervention, we are reducing the damage we do to them. Working. So if somebody else could move this forward for me, thank you very much. I'm providing examples here of both this beneficial and the potentially net widening effect from a randomized trial that was done of what's known as the Turning Point scheme in Birmingham. This was a randomized trial that randomized people who were caught for low-level offences, including drug possession. And they were randomly allocated to either go through the normal prosecution and court process, or to be given a diversion scheme, which was known as Turning Point, which gave them an assessment and referral on to educative and therapeutic interventions. And you see 3 different outcomes from this scheme as shown by these 3 graphs. On the left, the first graph, graph 1, we saw reductions in the severity and amount of crime committed by people who were randomly allocated to be diverted away from prosecution compared to those who were prosecuted. What the evaluators used here was a measure of the severity of the offence multiplied by the number of offences which gave them an overall measure of criminal harm that was done. And the level of criminal harm in the group that was randomized to be diverted was 36% lower than it was in those people who were treated with prosecution as normal. In the second graph, we see quite an interesting phenomenon, which the evaluators called the consequences of actually being caught. And these consequences actually increased in the group that was randomized to be diverted. Because you see on the left-hand bar in the second graph that those people who are prosecuted, about 30% of those people, because of attrition in the criminal justice system and the way that many cases don't actually get to court, many of those people didn't actually receive any form of consequence from the offence that they committed. Whereas because of the immediacy of the diversion, people didn't have to wait for a court date, didn't need to meet such standards of evidence to be invited into the programme. There was more people in the Turning Point scheme actually received some form of consequence, even though it was not a very harsh consequence, than if they had been prosecuted in a normal way. In the third graph on the right here, we see a comparison of the costs, and we see much higher costs associated with the usual form of prosecution than diversion to these interventions. So a reduction of about 45% in the cost of dealing with these offences from diverting people. So we see here a reduction in crime, a reduction in cost, but an interesting increase in the proportion of these people who actually receive some form of consequence. So I'm inviting you to consider Cohen's questions and think whether this is a form of net widening and whether it's actually a good thing that we're doing more consequences to people, or that we're actually increasing the net of social control to which people are exposed. Another form of diversion is de jure diversion. Here is where the law is actually changed to allow or mandate police to send people to treatment or assessment instead of the usual prosecution process. And we see similar results to for diversion, whether it's de jure or de facto. But an interesting difference between dealing in a de jure legal manner compared to the de facto sort of practical manner is that this doing it in the law relieves the police with less discretion as to who or who not they are going to include. And so we see in many countries, including my own, very high disparities between ethnic groups in terms of who gets policed for drugs. In my country, it's you're about nine times more likely to be stop and searched for drug offences if you're black than if you're white, and that's commonly experienced across many countries. And so when we have discretion in the system, because of the existence of institutional racism, that can be disadvantageous to some groups, including minority ethnic groups. But apart from that, we see similar effects for de jure compared to de facto schemes, including, for example, that we see reductions in the use of police time, better outcomes in terms of not damaging people, not giving people damage to their employment and accommodation or relationship prospects because of this criminal record. And we also saw, for example, in the evaluation of the South Australian Cannabis Expiation Notice, which was a small fine instead of a prosecution, that there were similar trends in cannabis use across the states and places in Australia that did or did not have such a scheme. But there was a net widening effect. So because it was easier to give people this expiation notice than to arrest and prosecute them, there was a 2.5-fold increase, 2.5 times more people getting some form of recorded response from the criminal justice system to their cannabis possession than was previously there. And this had the added effect in the South Australian scheme, because it involved getting a fine. This expiation notice included you had to pay a fine to have this expiation. And many people either didn't or couldn't afford to pay this fine. There were increases in the number of people who were imprisoned, even though they were being imprisoned for failure to pay the fine rather than directly for their drug offence. The next type I want to discuss is decriminalisation with diversion. This is where there is a formal legal de jure decriminalisation, a removal of the criminal offensive possession from the law, as occurred in Portugal in 2001. But there may be still administrative sanctions, such as small fines, or the removal of driving licenses or licenses to carry firearms. So Portugal is the best known example. Oregon has also recently moved to a similar sort of diversion approach to decriminalisation. Let's have a look at some of the evidence from Portugal. And let's remember, when looking at this evidence, that Portugal didn't just decriminalise the possession of small quantities of all drugs, not just cannabis. It also invested heavily in welfare reform. It introduced a guaranteed minimum income and invested in harm reduction services, expanding the provision of opioid substitution treatment. So these effects I'm showing you are not just of decriminalisation. They're of a systemic approach away from a criminal justice approach and towards a public health approach. But by adopting that, Portugal saw substantial reductions in the proportion of people in its prison population who were there for drug offences. And if we compare that to a fairly stable or even increasing picture in the rest of Europe, this is a good outcome from decriminalisation. Fewer people in prison, less overcrowded prisons, better conditions, better chances of rehabilitation for those people who are in prison. But the main focus of Portugal's public health approach was health indicators, a crisis in the late 90s of HIV infections being transmitted between people who inject drugs, and there has been a substantial and sustained reduction in the numbers of people who catch HIV from injection drug use since this public health and decriminalisation approach was introduced in Portugal. There was also a substantial reduction in the number of people who are dying with drugs. So the orange line here is the number of drug-related deaths in Portugal, and we saw a substantial reduction immediately after the introduction of this decriminalisation and public health approach. Unfortunately, in more recent years, we're seeing that number creep back up, but still nowhere near the average level of the European Union, and still nowhere near the huge and horrific increases we've seen in the numbers of people dying with drugs in the United Kingdom. And we should also bear in mind the views of people who use drugs in Portugal, as reported by the International Network of People Who Use Drugs in their report, Is Decriminalisation Enough? In that report, they report that people who use drugs are still being subjected to stop and search by the police. It hasn't removed entirely the criminalisation and stigmatisation of that part of our population. Those people still occasionally experience violence from the police, still stigmatised for being drug users, even if they're being seen as sick people rather than criminals because of the public health approach, still exposed to an unsafe, uncertain drug market because this decriminalisation doesn't deal with the illegal market. In fact, it leaves that market in the hands of organised criminals. And so in this report, the International Network of People Who Use Drugs argues that decriminalisation in Portugal is just a first step, an incomplete and partial step towards the fuller decriminalisation and legalisation of these substances. Another form of decriminalisation, which is the most common form in America, but is also the form of alternative that's been in place in Italy for many, many years now, is replacing the criminal offence of possession with a civil offence and civil sanctions for that. So in many states in the USA, for example, since the 1970s, the possession of about an ounce of cannabis has been met with civil fines rather than criminal punishments. Now, this does have the advantage of reducing the numbers of people who are arrested and then sucked into the criminal justice system for their use of cannabis. And in a similar way to legalization. So here we see 3 graphs taken from a study of the effects of different drug policy reforms in states that have or have not either legalized or decriminalized possession of cannabis compared to those US states which have kept their prohibitionist stance intact. And we see in both legalization states and decriminalization states substantial reductions in the number of people arrested for cannabis-related offences. And interestingly, we see this effect being especially beneficial for people who are classified as Black, because those are the people who are most exposed to the harms and pains of criminalisation of cannabis possession, and those are the people who've seen the greatest falls in the numbers of these arrests, even if it remains disproportionately that it is Black people who are still facing the brunt of punishment for cannabis offences compared to white people. But there is still what I would call residual criminalisation in those states that have decriminalised the possession of cannabis. So we still see punishment and imprisonment for non-payment of fines, as we saw in the South Australian example. We still see, therefore, continued class discrimination in the response to drug possession, because poor people are less likely to be able to pay these fines. It is them who are most likely to end up being imprisoned for non-payment of fines, whereas more wealthy people can just treat these fines as a tax on their enjoyment of these substances. We also see the use of punishment for related offences. So many years ago, cannabis had already been decriminalised in New York, but that didn't prevent a tenfold increase in the number of people who are being arrested for marijuana-related offences between 1997 and 2007, because it was still a criminal offence to have cannabis on public view. So when the numbers of police officers were dramatically increased in New York, and they went around telling people to empty their pockets, when people emptied their pockets and made that cannabis visible, that was then committing the offence of having cannabis on public view. So even though cannabis had formerly been decriminalised, these other offences related to cannabis were still used to increase the criminalisation and punishment of people who used cannabis. We also see an interesting, sort of parenthetically, I would say, we see an interesting difference between legalization and decriminalization in its effects for young people. And these graphs show us that legalization might not be particularly effective in reducing the punishment of young people in particular, because legalization is normally done for minors only, people under 21 usually in the United States, whereas decriminalization is normally applied to all age groups. And so we've seen in the United States larger reductions in the arrest of minors under decriminalization than we have under legalization. Now, the final form of decriminalization I want to talk about is decriminalization with no sanctions at all. This has usually occurred when countries have had decisions made by their constitutional courts that it is unconstitutional to punish people for their own behaviours around drugs. So Germany and Mexico have both had constitutional court decisions saying it's unconstitutional to punish people for possession of small amounts of drugs. It was done by a legal move in Vermont as well, where cannabis possession was decriminalised without replacing the civil fines in the couple of years before Vermont moved on to actually legalise cannabis supply. But still in Germany and in Mexico, there is formal decriminalisation, legal decriminalisation with no sanctions to replace it because of these decisions of the Constitutional Court. But there's a problem here, because in Germany, for example, the Constitutional Court did not decide what the threshold would be for small amounts. And there are arbitrary and variable limits as to those amounts. So, for example, in Berlin, which is a more liberal state, or part of Germany, you see a higher threshold for the amount of cannabis you can have compared to Bavaria, a more conservative part of the country, where that amount is quite low, considering that 30 grams is about an ounce. So in Berlin, they're about the same level of generosity, if you like, as most American states, whereas in Bavaria, they're much lower. In Mexico, we see even smaller thresholds being used, meaning that many people who use drugs continue to be criminalized for their possession, even when it is just for their personal use, because these thresholds are so low. And in Mexico, we still get repeated reports of drug offences being used as the pretext for intervention in violent and discriminatory ways with populations of people who use drugs in that country. Again, this is not, we think about this in terms of whether it goes far enough. And we have another report from the International Network of People Who Use Drugs suggesting that we need to go beyond these limited forms of decriminalisation to what they call full decriminalisation, with no arbitrary weight limits, no residual criminalisation, and towards full decriminalisation, which they would say includes legalisation of the market. Now, I would, compared to that call for full decriminalisation that we have from the International Network of People Who Use Drugs, the sorts of calls we have for these alternatives in international documents, such as the European Union Action Plan on Drugs or the United Nations coordinating body call for decriminalisation, are much more limited. So the European Union calling for alternative to coercive sanctions rather than clearly coming out and saying that we shouldn't be treating this as a criminal offence. The United Nations, for example, calling for decriminalisation, but without specifying what form of decriminalisation they're meaning, and many countries interpreting this to mean forms of decriminalisation that retain some form of control and indeed punishment for people for use and possession of drugs. So I'd like to leave you with these questions. How can we best reduce the pains of punishment and increase the benefits of treatment while avoiding this increased number of people exposed to state intervention, avoiding the intensification of the control we place upon people by making that net more burdensome and harder to get out of, by avoiding reinforcing the idea that drug use and people who use drugs are always pathological, either criminal or ill? Can we design a system that treats those people as people who choose to use these substances, who may occasionally have health problems that they might need help with, but aren't necessarily either mentally ill or deviant in themselves? And when considering those questions, I'd like you to think about Cohen's warning that he included in his book on visions of social control, that you can't just look to people like me to answer these questions for you. These are not purely scientific questions, and they're not purely political questions. These are inherently moral questions. And so we all have to look to our own moral judgments and discuss them amongst ourselves in order to come up with how do we answer these questions about the right way to deal with the issues that are brought up when people decide to have drugs in their possession. And in doing so, please also be inspired by the example of Alison and Eddie. In his obituary of Alison, John Podmore wrote that Eddie's and Alison's love story was one fueled by a noble passion. And I hope in some small way at least, I've helped to transmit their noble passion onto you to find more moral as well as more effective ways of dealing with drug possession. Thank you very much indeed for allowing me to fulfill this very honoured position of doing this memorial lecture for you. Thanks, Paddy, and thanks to you all.